Picture this for just a moment. It's a quiet Tuesday morning. Margaret, a 72-year-old widow from Ohio, pours her coffee and slowly opens her mail. Inside, she finds a thick envelope from her Medicare Advantage Plan. She glances at the cover, sees the words Annual Notice of Change, and sets it aside. She tells herself she'll read it later. After all, her plan worked fine last year, so it should be fine again this year, right? 3 months later, in early January, Margaret walks into her doctor's office for her arthritis checkup. The receptionist looks up at her with a worried expression and says, "I'm so sorry, Margaret. We no longer accept your plan. You'll have to pay full price today or find a new doctor." Margaret's stomach drops. Her hands begin to shake. She thinks about her heart specialist, her pharmacy, the medications she depends on every single day. What if those change too? She tries to switch plans, but she's told the enrollment window has already closed. In one heartbreaking moment, Margaret realizes she missed something important, and now she is stuck for an entire year. If you are watching this video right now, please do not let this happen to you. I am June, a Senior Policy Analyst who has spent years helping retirees protect their benefits, their pensions, and their health care. And today, I'm going to walk you through the exact Medicare Advantage changes coming in 2026, the steps you must take before open enrollment closes, and the rules that quietly changed under the new federal Medicare law. And please, stay with me until the very end, because there is one hidden mistake that millions of seniors make every single year. A mistake that can lock you out of your benefits for 12 full months. I will reveal it before we finish, so don't go anywhere. Let me tell you about Robert. Robert is 68 years old. He's a retired postal worker from Texas, a good man, careful with his money. He paid his bills on time and never missed a deadline in his life. He had a Medicare Advantage plan he loved. The premium was $0. He got dental coverage, vision coverage, a small over-the-counter card for vitamins, and even a monthly grocery allowance because he had diabetes. In September of 2025, Robert received his annual notice of change in the mail. He saw the thick booklet, looked at the size of it, and thought to himself, "I trust my plan. I don't need to read all this." He tossed it in a drawer and forgot about it. He missed open enrollment. October passed, November passed, December passed. On January 1st, 2026, three things happened to Robert at the same time. First, his grocery allowance disappeared completely. The federal pilot program that paid for it, called the Value-Based Insurance Design Model, was officially terminated by Medicare on January 1st, 2026. Over 7 million low-income seniors lost those exact benefits overnight. Second, his diabetes medication moved to a higher cost tier. The new copay was 4 times what he used to pay. Third, his favorite endocrinologist was no longer in-network. Any visit would now cost him the full price. Robert called his plan in a panic. He begged them to fix it. They told him very politely, "Sir, you had until December 7th to switch. Our hands are tied." Robert was locked in for an entire calendar year. I'm telling you Robert's story because I don't want it to be your story. So let's talk about exactly what is changing in 2026 in plain English. The first and most important date is October 15th through December 7th. This is the annual enrollment period, and it is fixed by federal law. This is your one main window each year to join a Medicare Advantage plan, switch plans, drop your plan, or change your prescription drug coverage. If you miss this window, you generally have to wait an entire year. There is a second window, January 1st through March 31st. This is called the Medicare Advantage Open Enrollment Period. But here's the critical thing most people don't know. This second window is only for people who are already enrolled in a Medicare Advantage plan. If you are on Original Medicare, you cannot use this window to join a Medicare Advantage plan. And it only lets you make one switch. One, not two, not three, just one. Now let's talk about the actual cost changes for 2026 because these are real numbers from the Centers for Medicare and Medicaid Services. The standard Medicare Part B premium is going up to $202.90 per month. That's nearly an $18 increase from $185 in 2025. The Medicare Advantage in-network out-of-pocket maximum is now $9,250 for the year. That means, in the worst case, you could be responsible for up to $9,250 of in-network medical costs. And listen carefully. If your plan is a PPO and you go out of network for non-emergency care, that cap may not apply at all. You could face unlimited costs. There is good news too. The Part D prescription drug out-of-pocket cap is now $2,100 for the year. Once you spend $2,100 on covered prescriptions, you pay zero for the rest of the year. The maximum Part D deductible is $615. Insulin is capped at $35 a month or less, and recommended adult vaccines under Part D are now completely free, with no deductible. There is also a brand new federal protection. Under the 2026 Medicare Advantage final rule, if your plan approves your inpatient hospital admission, it cannot go back later and reverse that decision except in cases of clear error or fraud. This is a major win for seniors who used to get hit with surprise bills weeks after a hospital stay. Now, here is something very important for our viewers in 6 specific states. If you live in Arizona, New Jersey, Ohio, Oklahoma, Texas, or Washington, Original Medicare is starting a 6-year prior authorization pilot program in 2026. This means even on Original Medicare, you may now need pre-approval for 17 specific services. This is brand new, and it is catching many seniors completely off guard. I also want to warn you about something the Kaiser Family Foundation reported in their 2026 Medicare Advantage Spotlight. Many plans are quietly reducing extra benefits. Over-the-counter allowances dropped from 73% of plans down to 66%. Meal benefits dropped from 65% to 57%. Transportation benefits dropped from 30% to 24%. So the plan that offered you a generous OTC card last year may have cut it down significantly for 2026. You will not know unless you read your annual notice of change. So let me give you the 3 exact steps you must take right now to protect yourself. Step 1. Find and read your annual notice of change. This document is required by law to be mailed to you by September 30th each year. It tells you every single change to your plan effective January 1st. If you cannot find it, call your plan immediately and ask them to send another copy. Do not skip this step. This is your legal early warning system. Step 2. Go to the official Medicare website at medicare.gov and use the Plan Finder tool. For the first time ever in 2026, the Plan Finder shows you which doctors are in-network for each plan. Type in your doctors, your hospitals, and every prescription drug you take. Compare your current plan against at least 2 other plans. And remember, if a plan's directory turns out to be wrong about your doctor, there is now a special enrollment period that allows you to switch plans within your first 3 months. That is a brand new right for 2026. Step 3. Get free, unbiased help from your State Health Insurance Assistance Program, also known as SHIP. This is a federally funded counseling service. They do not sell plans. They do not earn commissions. They simply help you. You can find your local SHIP counselor at shiphelp.org or by calling 1-800-MEDICARE, which is 1-800-633-4227. You can also speak with AARP, which provides free Medicare guidance to seniors across the country. Now, before I close, I promised you one hidden mistake that costs seniors their benefits. Here it is. Most seniors believe that if they do nothing during open enrollment, their plan simply stays the same. That is the most expensive misunderstanding in all of Medicare. Doing nothing does not mean keeping your benefits. Doing nothing means accepting every single change your insurance company makes for the new year, the higher copays, the dropped doctors, the new prior authorizations, the smaller drug list, and the reduced extras. Silence is not protection. Silence is consent. And here is something else many people miss. If you signed up for the Medicare Prescription Payment Plan in 2025 and you switched to a different drug plan for 2026, your monthly payment arrangement does not automatically transfer. You must re-enroll with your new plan. If you do not, you could face the full cost of your prescriptions at the pharmacy counter on your very first visit in January. My friends, please hear me. Do not rely on YouTube notifications to keep you informed about your Medicare benefits. YouTube is not the government. We try our best to bring you accurate information, but rules can change, dates can shift, and your specific plan may have details that only your official mail and the Medicare website can confirm. Go to medicare.gov today. Call 1-800-MEDICARE. Reach out to your local SHIP counselor. Read your annual notice of change. And if you have a friend, a neighbor, or a family member on Medicare, please share this video with them. One conversation could save them thousands of dollars and protect their access to the doctors they trust the most. This is June from Retirement Tax and Law Pro, reminding you that your benefits are your right, your voice matters, and the small actions you take today will protect your peace of mind tomorrow. Take care of yourselves. Read your mail, ask questions, and I will see you in the next video.